have Zisha Schnitzler. He's a director of recruitment. And Esther Fetter is director of onboarding and retention. Now, they both work with Preferred Home Care of New York. And then our additional guest, who's going to tell us what it was like, what she felt as a home care professional. Michael and I can tell you, we can put it on the slides, but it's nothing like hearing from the individuals who do the work every day and who worked every day during the pandemic. So that's Miss Nicole Mobley. She's a home care professional. She's not employed with Preferred Home Care of New York, but she is a home care professional who will share her story with us today. So welcome, guests, to our weekly webinar, and thank you for coming. So let's get started. I want to talk to Zisha. Zisha, tell me a little bit about your role at Preferred Home Care.
Yeah, absolutely. So I am, as you mentioned, I'm the director of recruitment, and I oversee a team of 25 plus individuals, staff members that are responsible for registering between 250 and 300 caregivers monthly on a monthly basis. My team is tasked with pretty much handling everything from the applications all the way to the hiring process, and to ensuring that the new hires and new caregivers are receiving the case that are specified to their needs. And this is something that Esther can attest to, and she can give some insight on that side as well.
Mm-hmm. So Zisha, what is Preferred Home Care's mission statement?
So our mission statement, yeah, absolutely. So our mission statement in a couple of bullet points would be like, pretty much we, as a healthcare industry as a whole, we could be the stepping stone to the healthcare industry, right? So if somebody's looking to make a career out of themselves, and they want to start somewhere, and they want to start somewhere where they don't have to spend too much time in school and too much effort getting into it, and it also provides them experience that they would need it. This is a great place to start, as well as it's a great place to, we are providing opportunity, we're providing jobs, as well as financial security. Now we are at a time where over 30 million people in America have lost their jobs. That's about 10% of the entire population of America have lost their jobs. And in the healthcare industry, we are constantly in need of new employees, new hires, more caregivers to take on cases. And it's not just Preferred Home Care; it's an entire healthcare industry. But Preferred Home Care is just one small speck of the entire industry, that we constantly are in need of caregivers, even at a time like this, at a time where it's just extremely difficult for people to find work.
Yeah, Esther, I just want to ask you a question, if I may. So you're in charge of onboarding and retention, right?
Correct.
Okay. So what adjustments have Preferred Home Care have to make for the pandemic? What kind of adjustments? I know that, do your staff work remotely? It looks like it, maybe. Are you guys working remotely?
We all working remotely, as you see. I'm working from home as well.
Okay. So what
the process
adjustments did you have to make for your workers? Mm-hmm. Go ahead.
I'm sorry, I didn't hear that.
What adjustments did Preferred Home Care have to make because of COVID-19 in the hiring practice? Do you do remote interviews? What's the process now?
So we do online application. We have a very large team who is really on top of all the applications are coming in online. We're processing them as fast as we can so people can have more job and faster jobs. We also understand that the aides are a little bit, with all the scare that's going outside. We have a large team that goes out and delivers all the gear, the protective gear, to all the aides. When they do go to the cases, they are protected, they're protecting themselves. Our patients are protected as well. We also flexible. We understand that the aides have families and they have hardship at home. So we're really trying to give them flexible hours according to their availability as well.
Right. So is it for Zisha or Esty, is it any changes that you had to make that you're going to continue with it? Did you find a process that really worked, and so you're just going to continue with it after the pandemic?
So yeah, I think it's two parts to that question. One is the application process itself. We have shifted towards digital processing. So a big portion of the hiring process is now digital. And it's something that we created in-house, which means we can tweak it if necessary. We can add some paperwork. We can, change some things. And the second part of that is safety. I think with this whole pandemic, it has shifted, and I can probably attest to other companies, not just Preferred Home Care, other industries as well. It has shifted our focus as humanity. It has shifted our focus towards safety and the safety of our employees. So with that in mind, like Esther mentioned, providing PPE equipment to those out in the field, to those in need, and ensuring that they are in safe hands. We do constant, daily routine checkups to ensure that everybody's feeling well, the caregivers are feeling good, the patients are at the top health and progressing. And I think that's not just in the times of the pandemic. It will also reflect post-COVID. It will also reflect just ensuring that everybody's in a safe and secure manner.
Excellent, excellent. Yeah, because I was curious to know, did people cancel out from work? I'm sure, but did you find that more of your home care workers just like canceled out when they started to get really, really scared?
So yeah, so Esther and I were actually both talking about this. So in the beginning, this was sort of a scary situation for a lot of people, as well as us, in the in-house staff as well. It was a very scary situation. We didn't really know what was happening. We didn't know what was going on, or we didn't really know what we were getting into. It was sort of like this unknown door opening.
Yeah.
We just had to go through that. And it was sort of a hard time because of that. And a lot of people, yes, definitely, a lot of people were canceling out, were calling out just because they were scared. But after a while, everything sort of neutralized and people started realizing that this scary portion was over. Even though there was constant, corona cases still happening, but it was more so this feeling of unknown. That feeling sort of surpassed and it sort of neutralized on its own. So yeah, we did have, especially in the beginning, we had a lot of people that were calling out, but then eventually as we calmed them down, as they were calming themselves down regarding this whole situation, people started to come out of their houses and, out of their sort of comfort zone to go back to work and to really do what's necessary for elderly individuals who really need that. We need the help.
Yeah. So Nicole.
Yes.
Nicole, can you hear
Hi.
me? How are you?
I'm fine.
All right. So I wanted to rope you into this conversation because we're now talking about those fears. Did you, I know you work for a different agency, but did you take off from work during the pandemic at all?
No, I didn't. I went in every day.
Why not? Wow.
I mean, I thought about the client. I'm more of a, if I take off, who's going? And then to have someone new to go to the client's house, that client is in jeopardy because you don't know. At this point, everybody was walking around terrified. So I just continue to go to work so they see the same face and to calm them so they don't panic.
Right. How many cases did you have or do you have?
Well, at that time, from March to April, I had 3.
Wow.
I did a husband and wife in one house, which was safer for them because they only seen me. It wasn't someone I tried not to take off, stay home with my grandson. I just went in to reassure them that they'll be safe.
So walk me through like so now this is in the thick of the pandemic, right?
Yeah.
And you have to go to work. Walk me through what you were feeling that first day going into your patient's home. What were you feeling?
I was terrified. I didn't know. You hear, the news. I had to stop watching the news. I really had to stop watching the news because the news made it seem like everybody had it. Somebody's coming in and touching you and you got it, like the cooties, and you can't. So I just listen, I got on my knees. This is, Lord, just cover me because this is something I have to do. Cover me. I don't know what's going to happen, but I'm walking in faith. And that's the way I did every day.
Did the climate in the home, like did it change? Like
Oh yes.
your relationship with
yes.
your patient?
Yes.
How
yes.
so?
The client got nervous. One of the clients was nervous. You couldn't do everything you did for her. You know, she was washing your hands, cover your face, you know, and it was this irritating.
Yeah.
You know, I'm safe. I'm coming into you. Thank God that I came into you and didn't let nobody else come into you. So it was a little crazy. It was getting to be crazy. But you understood.
How did you protect yourself?
My
How did you protect yourself?
Mask and gloves. Mask and gloves.
Did you do anything different when you were in the home servicing them than you normally would do?
Well, normally I didn't have to wear a mask all day. So now I had to, you know, wear the mask all day. Every time I went into the room with the client, I had to put on a different mask. You know, I had to constantly change where it was getting costly, you know, and then you can't find masks. So now it's like, okay, what do we do? Because then nobody could find them. Everybody was going in trying to get them, and it was hard to find them. So.
Okay. And your agency wasn't providing them at that time?
They didn't. They were scrapping for them themselves. Everybody was scrapping, trying to get them. And now they have kits for the employees, but you still, it's still run and get it.
Yeah. Is there anything that you did as a result of COVID-19 as a policy? Because we know about universal precautions, so we assume that all is infectious, right? So knowing that, is there anything that you did during the pandemic that you're going to probably continue to do, just going to be a natural practice? Do you think you're going to always wear a mask? Is there anything that you're going to just continue to do regardless?
Always wear the mask. Not so much of the gloves, but constantly washing, hand sanitizing, because you don't know. When I get home now, I strip at the door. You know, I don't come home. You know, you normally come in the house. No, I take everything off because I don't want to bring nothing inside.
Yeah. Well, I commend you. I want to just say that because, you know, for those of us who worked remotely, we worked from home. And so I was able to stay inside with my family, you know, but you went out there and you put yourself at risk for someone else's family. Right.
Yes.
To make sure that they're safe. And a lot of the patients, and I'm sure Zisha and Esther, you agree, some of the patients, you're probably the only person that they're going to see sometimes. They may not have additional family members who will come in and say, hey, no worry about it, Nicole, you don't have to come. I took care of my mom today. Some of them don't have that.
Yeah.
So you went through all of this and you did it, and I commend you for it. I don't know how many have said this to you, but we appreciate you.
Oh, thank you.
We appreciate you, and I know Michael will agree. You're welcome. We definitely appreciate you for your courage, and your commitment.
Absolutely. You know, I do. You know, Nicole, Serrina and I were having this conversation yesterday. You know, even before COVID-19, I feel that, you know, people like you, Nicole, in this field is underappreciated, and and this is like, you know, kudos to you for doing the job, and it sounds like you're very passionate about it. You know, people don't understand that in this role that you're in, not only are you physically taking care of folks, but emotionally it could get to you as well too, because you build a relationship. You're building a relationship with the people that you're taking care of, you know. And unfortunately, you know, whether it's a passing or whatnot, there's always that emotional attachment to it. And you know, and now obviously that's been amplified with COVID-19. So I really, you know, like hats off to you and everybody else that do what you do. So thank you so much.
Thank you.
What kept you going, Nicole? What kept you going? Besides your love for your patient, and what else kept you going?
You know, I just kept hearing my pastor pray and wash. Pray and wash. Okay. That was the thing.
Well, you want to shout out your pastor on the webinar, because your pastor is my pastor. So you can, if you like.
Pastor David L. Kelly II. He was washing and praying. And I did it. I had to do faith over fear. That was my thing.
Yeah.
My slogan was, even my mask says, faith over fear.
There you go.
So that's what I walk with every day, because you have to.
There you go. Yeah,
You
yeah.
have
I
to.
think it's important, the mental health and the spiritual health, whatever it is, it doesn't even matter, you know, whatever you believe in, whatever your faith is, that doesn't
Right.
matter. But just to make sure that you have something else going with you. You had to have more armor with you.
Yes.
You need
Yes.
all of those pieces of armor in it every single day. Yeah.
Yeah.
So let's go. Thank you, Nicole. So let's go back over to Zisha for a second. Zisha, what positions do you currently have open at Preferred Home Care?
Absolutely. And before we continue, I just wanted to give it up to Nicole. You know, talking about being so selfless and you know, worrying about the patient, not so much about yourself. And I don't know about you, but when I wear a mask and gloves for 5 minutes, I just can't breathe.
Yes.
Doing that all day, I you know, I applaud you for being a frontline worker and being so selfless. And I speak for Preferred Home Care as proud as we are to applaud the frontline home care workers. So thank you.
Thank you. Thank you.
Yes.
But now back to your question, where you're talking about,
Okay.
Serrina, as far as the available cases. Now, this is an ongoing need. There's constantly, you know, constant incoming flow of new cases and a constant flow of you know, cases that are changing the dynamics. So there's always a need for cases, and there's always actually a need for caregivers to cover cases, and there's always sort of an upwards trend for caregivers to cover cases.
Okay. So which particular, I guess, Esther, you can tell me. So you need home health aides right now. Do they have to be certified already? Do you do training? What positions do you have open now?
So yes, in order to work with the agency, you do need to have a certificate, and we constantly hiring on daily basis new aides. But in case somebody is looking for a good opportunity, we are offering training as well. The training is short, the training is not long, and as they finish the training, we give them a case right away. We put them on to work. We make sure we're giving them cases in their area, close to their house. You know, with all this pandemic, we're trying to give our aides cases as close to the house so they don't have to travel long.
Oh, great. That's beautiful. Mm-hmm. So what we're going to do is, anyone who are viewers today, if they're interested in home care, you're going to send your email, and if you want your one pager and you're interested in home care, we'll provide you with the information for Preferred Home Care. Is there any particular site that they need to call, Zisha? Anyone?
Yeah, so there is actually, it's a very
site?
simple.
I know you have a lot of sites.
Yeah, it's a very simple link. If they just go to preferredapplications.com, it's a quick and easy application, and we have our team that are constantly monitoring new applications that are incoming. So as long as they provide, you know, phone number, email, all the contact information is there. As long as they provide everything, then they can, our team can contact them and ensure that their turnaround on the registration process is efficient and quick. But if they do have any other issues, then Serrina, I provide you some, you know, some direct phone numbers, so you can provide it to those people that are interested.
Excellent.
Yeah.
And we also have it in a couple of. I'm so sorry. We also have it in a couple of languages also.
Oh, wonderful, wonderful,
Yes. Yeah,
excellent.
to choose different
provided for me.
All languages.
Correct.
Excellent, excellent. So I want to make a shout out to Lisette. Lisette is one of your staff, right, Zisha?
Yeah, she's
my friend over there. Home care. Yes. She's my major contact over there. I think we've been together like a couple of years, and then before that was Josh. Right. So you can know how far I go back with guys. So we've been partners for a while. So at this point, what I'd like to just ask you is, this is where we ask our guests to give us their final thoughts. So I'm going to start with you, Esther. Just what would be your final thought that you want all of our viewers to take away today?
That there are opportunities. We do have jobs. It's very simple to do. You just have to get it done, and we offer training, we offer opportunities. We have a very large team of people who are processing, so people are not waiting long for a job. And we're taking care of our aides.
There you go. And Zisha, what would be your final thoughts?
My final thought is that it's time for everybody to go back to work. It's time for us to, like Nicole mentioned, to stop watching the news and to, stop being afraid of what's out there, even though it exists, even though it's there. And definitely we should keep washing our hands. Faith and washing, right? Is that what you said? Definitely do that. But also, like Esther said, there's tremendous opportunity to consistently find work, find security as well for yourself financially. And definitely, I think it's time as a human race just to move further. I mean, there was a pandemic 100 years ago. At some point, it just went away. How? Nobody knows. But I think it's sort of the mind consciousness, realizing that it's, stop listening to the news, stop listening to what other people are saying, keep going. Obviously, stay safe, wash your hands, do everything that will just make you that much safer. But I think it's time to go back. And actually, next week, Monday, June 15, our offices are going into phase 1 and starting to reopen. So I'm very excited about that. And I think that's the final say in all this is that it's, we're definitely moving forward and progressing out of this.
Okay. All right. And of course, Nicole, what are your final thoughts that you like all our viewers to go away with today?
I just suggest that everybody go get tested. Just go get tested, because you need to know, because the anxiety will drive you crazy. Not knowing will drive you crazy. So everybody should go get tested.
Absolutely.
It doesn't hurt. It doesn't hurt.
Look at your mask?
Absolutely.
Can we take another look at your mask?
Huh?
Nicole, you want to show us your mask one more time?
That's it. Faith over fear.
Yes.
Yeah, faith over fear. So maybe we should change this webinar today to faith over fear. Yeah.
Yes.
Michael?
Agreed. Well, for me, thank you all three of you for joining us today, really giving us some really good insight, from Preferred Health, and Nicole, of course, being the front line. So thank you all for joining us today. I do have a question for Esty, question regarding your training. Are there any types of qualifications or any kind of requirements you're looking for in order to qualify somebody into the training?
The qualification is only like a complete physical with the lab results and a social ID.
Over 18.
And over 18. Okay, great.
Yeah.
Right.
And then the case loads, are they specifically in certain boroughs, or are they all over New York City?
We have cases all over the 5 boroughs, Long Island, Westchester. We're spreading on daily basis. We have a large team of marketing. We're getting cases on daily basis, and I don't think we have aides who are willing to work and are not on a case.
All right. And does this include overnight as well too?
We have overnight, we have all kind of cases. We have shorter hours, longer hours. We have overnight, we have living cases, which we have aides are rotating on daily basis, like from morning to morning. We have all kind of cases, and we really work with the aides according to their availability. We understand that they have families, they have different responsibilities as well.
Just one thing.
Awesome.
So the training, is it for the certified, is this the training for the certified, those who come to you already certified? Or is this training for people to become certified, or both?
The training is for the people who are interested to be certified and continue to work with them. We offer them training. Once they're completing the training, they do have an opportunity to work with us, and we're giving them cases right away. The aides who are coming with a certificate, the process is literally a day or two, and we put them on a case right away.
Mm-hmm. Yeah.
Fantastic.
Yeah, that's what I thought. Yeah.
Thank you.
So are you providing in-services? Do they do in-services?
Absolutely. Yep.
Yeah, and we actually shifted our in-services
towards virtually now?
digital in-services.
So, virtual in-services.
Exactly.
So Michael, so you made me think of some other questions.
Yeah.
We're a great team.
Absolutely. Again, thank you so much.
Yeah, I think this day and age, I think in-service are very important as well, because those are the things that will keep people abreast of what's going on. So it's important that the in-services are done. Yeah, so you guys did terrific today. We thank you for coming on to our webinar, and anyone who's interested in any additional information, they know how to reach us. We'll be back next week, God willing, on Wednesday at 1 o'clock. And we'll have a different topic. So thank you all for tuning in today.
Thank you, everyone. Be safe.
Thank you.